We are going to talk today about the use of biomarkers for dementia detection in the MENA regions, some opportunities and challenges.
I think there is more knowledge about Parkinson's in the region compared to Alzheimer's disease. The fact is we have more neurologists in the region compared to geriatricians. We have less geriatricians. Parkinson's issues has received more attention in the past. Now, recently, we have more interest in dementia, rising gradually, but my feeling is still lacking behind compared to Parkinson's disease. Still, Parkinson's disease needs more attention, but the fact that are enough number of neurologists help a lot in making Parkinson community more aware about the disease. They seek treatment early compared to the dementia care. Mahmoud, what is your feeling?
Yes, no, I totally agree. I think there is a greater awareness and a greater pool of expertise. In particular, there are a number of people who do visit the MENA region for short terms, possibly in both private and government-run institutions to assist. There is a diaspora of people who belong to the area, who've gone away and have returned with all their various experience and boards and training to be nearer to home and be, in their own perhaps milieu. And so it's encouraging to see that. I also think that there are the number of people who are suffering from the major neurodegenerative diseases is increasing due thanks to the increased length of longevity of life. We have seen changes because of strife and troubles, of course, but in general, we are perhaps having a better chance of living longer and for these various diseases to emerge. There are many patients I've had with Parkinson's. There are many, I've had a few with Huntington's, had a few with, obviously, with Alzheimer's at various levels. There is a greater experience. I find that the family physicians are having to deal with more such cases and more presentations, and patients are more likely to go to someone, just as Dr. Abdul said, because the professional relationship is better. And the earlier the clinical symptoms may well be picked up so that something can be done. There are also some other signs which are not necessarily biomarkers. They're not actually, but simply being able to understand their patient's spatial abilities, for instance, as a forewarning before they actually have acute brain changes. These are important. Now, Dad used to be able to fix the shelves in the garage and put up a shelf, but now he can't do it. He's almost forgotten how to do it, and yet he acts normally. So there is a greater awareness, a greater understanding, not only by the professional community, but by the patient community too, because people are they do talk, and they sort of share information more readily now, especially with social media and the young in the family being much more switched on. So yeah, I think the answer to that is it's good progress, although perhaps not quite for the reason they want to make good progress.